Well, guys, if you're having bleeding while you're brushing your teeth, or um, when you spit out regularly, your gum bleeds. Well, here are 5 things you can do to prevent and stop your gums from bleeding. If this is your first time on my YouTube channel, dial under this video to your right. You will see a red subscribe button. I want you to click it just once. And when you do that, there will be a bell notification icon that will pop up so that you can see whatever I upload, any health tips. Click that as well. So you're brushing your teeth and you notice a bit of pink when you spit out the toothpaste. You might notice some bleeding when you floss. Although the smallest amount of blood might not seem like a big deal, if your gums are bleeding consistently, you shouldn't ignore it. Bleeding gums can happen for a number of reasons, from gingivitis to a side effect of pregnancy. Changing your oral health care routine can also make your gums bleed, at least at first. Here is what you can do if you notice some bleeding. Step up your oral health care game. According to Medline Plus, the biggest cause of bleeding gums is plaque buildup along the gum line. When you don't remove plaque in a timely manner, it hardens into a tartar, a calcified material that plaque adheres to and continues to irritate the gums, which causes them to bleed and can progress into more advanced forms of gum diseases. The best way to reduce plaque buildup and your risk for bleeding gums is to amp up your oral care routine. Remember to brush twice a day using a fluoride toothpaste. Floss at least once a day as well. Gums can sometimes stop bleeding with regular flossing. And of course, seeing your dentist on a regular basis, not just when you have a problem or concern, is also a must to keep your mouth in the best shape. Take a look at your tools. If you do brush and floss regularly and get your semi-annual dental visit in, your oral hygiene care tools could be what's causing your gums bleed. Although it might seem that a toothbrush with medium or firm bristles cleans your teeth and gums more deeply or thoroughly, harder bristles usually just cause irritation, which can be why your gums are bleeding. The American Dental Association Mouth Healthy site recommends using a toothbrush with soft bristles, such as Colgate 360R, which cleans your teeth and gums thoroughly without irritation. In some cases, it might not be the tools that are causing the bleeding, but the way you are using them. If you are being out of the habit of flossing, start again. You might see a bit of blood at your gum line, but remember to always use a gentle hand and avoid pressing the floss against your teeth and gums too hard. Maintain a healthy diet. What you eat and when you eat it also plays a part in keeping your gums from bleeding. Foods that contain lots of sugar or simple carbohydrates increase your risk for tooth and gum problems, as sugar creates an ideal environment for plaque to form. Commit to a diet that is low in sugar and high in the necessary nutrients found in foods like vegetables. You don't have to ban sweets from your life. Just remember to eat them in moderation and brush after these snacks so that the sugar doesn't have time to stick around. Consider your medicine. Certain medicines also increase the likelihood that your gums will bleed. Some over-the-counter pain relievers, like aspirin, thin the blood and can therefore increase bleeding. It is also possible for a prescription medication to cause gum bleeding. If that is the case, your doctor might prescribe a different dose or a different medication altogether. Although talk Always talk to your doctor if you think a medication is causing side effects, even if they seem mild. Always see your dentist. If changing your oral health care habits, adjusting your medications, and maintaining a healthy diet doesn't help your gums stop bleeding, your next step should be to make an appointment with your dentist. He will examine your teeth and gums and determine if you have a more serious condition, such as advanced gum disease. Your dentist might also take an x-ray of the teeth and gums. If he believes treatment is needed, such as deep cleaning or periodontal surgery, you will likely visit with a periodontist who specializes in treating gum diseases. In some cases, bleeding gums are no big deal, but in certain instances can warrant professional treatment. With the right diagnosis and personal care, bleeding gums can become a thing of the past. I hope you're able to learn a few things from not brushing too hard to using the floss and all. Feel free to ask me any question in the comment section. You can also check my other videos on how to deal with other forms of oral care. See you in my next video.